Thank you all for attending. It's very much appreciated. It's nice to see some familiar faces. There's some clients that I've seen already that I've probably known for nearly 20 years now. And then there's some of you that I've not yet had an opportunity to meet. So I look forward to meeting you in one of the clinics one day. But thank you very much for taking the time to come and join us tonight. I think this is the fourth or fifth time that we've run a Zoom event like this over the last year or so. We did it originally to find a way of engaging with our clients when we went into lockdown, because we were kept so distant from you. We also thought it might be a nice thing to be able to put on to alleviate some boredom when you were stuck at home and you couldn't get out quite so much. And it's nice that it's been so popular with you all. We do really appreciate you joining us regularly for these. Out of lockdown, we've decided to continue running the meetings. We just think it's a nice way for us to demonstrate that as a service, we're not just here to sell hearing aids, but we're here to take care of your overall hearing health. I think that's very important for us to get that message across as a little group of companies. We also continue to run these meetings as well, because hearing and hearing loss is still a very misunderstood problem. It's something that a lot of people don't understand, and it's something that a lot of people with hearing losses, friends and families, don't understand as well. And we just feel that the more we can help you to understand hearing loss, the easier that makes life for everybody. It reduces down a lot of the frustrations and feelings of isolation that can sometimes come about because of hearing loss. So we're going to try and run these meetings on a fairly regular basis. Our next one will be in about 3 months' time. And in 3 months' time, we've got a recent patient who's going to be interviewed for us. And he'll be talking about some of those feelings of frustration and isolation that come when you're dealing with hearing loss in social situations and within family and within the workplace as well. So hopefully you'll be able to join us for that, and some of his comments will sort of resonate with you as well. So without further ado, and no more waffle from me, it's time for me to introduce the main event, the main reason why you're here, and that's Mr. Sam Jayaraj. I've known Sam for nearly 20 years now. It's great for me as an audiologist to be able to have a trusted ENT consultant and surgeon that we can refer to. In clinic, we occasionally see ear canals or medical histories, or we do a hearing test and we get a result that is perhaps something that we're not expecting to see and that needs medical advice. Or sometimes we see an ear with wax in it that is beyond our dexterity and our skill set. And it's really nice to have someone that we can trust, that we can refer our clients onto. And at our Chingford practice, we've been referring people to Sam for quite a while now. So it's nice to have someone trusted that can do that. And on a personal note, about 6 years ago, I texted Sam one morning because my 6-week-old twin daughters were struggling to feed. They were struggling to latch, and it was because they had a tongue tie. And I texted Sam one morning after a particularly stressful night where we were up with the kids, and Sam came to the rescue that evening, and he got us in, and he looked after my twin daughters. And you don't trust anybody to put scissors in your 6-week-old daughter's mouths, but Sam was a hero for us that night. And so we very much trust him. And we're very privileged that we can have him join us tonight, because I know he's very busy as well. So without any more from me, I'm going to hand over to Sam, who's going to give us the talk, Maintaining Your Ear Health and Managing Earwax.
Thank you, Oliver. And thanks everyone for coming in tonight. Hope you find me as interesting as The One Show or Coronation Street or whatever you're missing out on. So I'm a local ENT surgeon. My interface is at Whipps Cross, part of Barts Health. I work privately as well. And as ENT surgeons, as the name suggests, just going to advance, we deal with lots of different ear, nose and throat problems, some which will be obvious to you and some may be surprising to you. And we overlap a lot with other specialties as well. We have problems in the throat that overlap with stomach problems, with dental problems, with chest problems, and with pediatrics and with eye surgeons as well. And some of these things are obvious and some are a bit more specialist. And you've heard about Oliver's experience with tongue tie. But you may be surprised that we do a lot of complex nose and sinus and facial plastic surgery as well. But that's not what I'm going to talk today about. I'm going to talk about the ear and how can we have healthy ears. And I think to understand this a little bit, we need to look at the different parts of the ear. So we have the ear canal. Can you see my cursor moving on the screen?
Yes.
Great. So we've got the outer ear and the ear canal, then the eardrum, then the middle ear, and then the inner ear. Now, in the ear canal is lined by skin, the same skin that lines our body. And behind the eardrum, the middle ear is full of air normally, and it has 3 little bones of hearing called the ossicles, the malleus, incus stapes, or hammer, anvil, stirrup. And they're joined by a tube that goes to the back of the nose called the eustachian tube that helps equalize our ear pressure. And in the inner ear, there's 2 parts to the inner ear. There's the balance part, so I've just jumped forward a bit. There's the balance part, these are the balance canals. And then there's the hearing part called the cochlea, the hearing part of the inner ear. And then we have the hearing and balance nerves that go to the brain. Now, when we look at an eardrum through the ear canal, it normally has a kind of grey, creamy, translucent type colour, like this. And this is the skin of the ear canal here. But of course, you can get problems with the eardrum. You can get infections where it goes red and angry behind it. And sometimes it can even bulge because it has an infection behind it. And when we see this, this is because of an infection behind the middle ear, a middle ear infection. So with this, you characteristically get problems normally after a cold, where you may get earache without any ear discharge, and the ear may feel blocked and muffled, may have a temperature, and it's pretty miserable, really. Very, very common in children, but of course adults get middle ear infections as well. And this we treat with painkillers and antibiotics usually. So this is an infection behind the eardrum here. Now, sometimes when you get infections here, they just get better or you need antibiotics, but sometimes they can actually burst through the eardrum. Now, actually, when that happens, the pain actually gets better, but then you have a little hole in the eardrum. This is a classic scenario where the drum has literally just burst. And as you can see, it's a bit wet because the infection from behind the eardrum has burst through the hole. But actually, when this happens, you actually feel a lot better, but you have the discharge. Now, people often get worried when they get a hole in the eardrum after a middle ear infection. But actually, these holes normally heal on their own very, very quickly, certainly within days or within a week or 2. And these are very, very common, and it's actually rare to be left with a permanent hole. But you can have a permanent hole if you have continuing discharge that comes through, but nearly always they heal on their own. And here we see a hole in the left picture here, which actually is a healthy ear. There's no infection, but there's a hole that hasn't healed, as opposed to this picture here where you can see it's all wet and swollen because there's an infection behind the hole. So we get 2 different scenarios with healthy holes that don't really matter if they don't trouble you, and holes that can bother you because you keep getting infections in the ears. Other types of infections you can get in the ears are outer ear infections, infections of the ear canal. And here we see an ear canal full of debris, muck, discharge. And these are the kind of infections that they can be painful, but actually the main normal issue is that it's blocked and discharging and feels sometimes crusty, squelchy, sometimes in the ear. We sometimes call it swimmer's ear. It's very common after swimming. And I'll talk about that in a bit more detail in a second. And these are the kind of ear infections that need treatment ideally in the ear canal. They need ear drops really, or sometimes GPs use ear sprays, but we prefer ear drops because they have an irrigating action. And the drops normally contain an antibiotic and sometimes a bit of steroid, which is anti-inflammatory to reduce swelling. But the key thing when you get ear infections like this is you want to keep the ears dry. So you want to avoid getting any water in the ears. And that means that when you have a bath or shower, you need to use a plug of cotton wool in the ear canal, in the outer part of the ear canal to stop water going in. But it's important you don't leave the cotton wool in. You just put it in when you have a bath or shower and take it out otherwise, because you want any discharge and muck to come out. And if this doesn't get better with drops or water precautions, then the ears might need to be cleaned. We call that ear microsuctioning, which can be done by a good audiologist like Oliver, or otherwise an ENT surgeon. Sometimes the ear canal can be so swollen, like this picture here, that you can't get eardrops in. In this scenario, we often put a dressing inside the ear called a wick, a Pope wick. And it's almost like a tampon that you put into the ear canal, and then you apply drops onto the wick, and the drops sort of diffuse through the wick and then reach the skin of the ear canal. And as the ear canal swelling reduces, it actually becomes loose and falls out, and then you can use drops normally. And again, this is something that you need to see an ENT surgeon about if you can't get drops in the ears and it's not getting better. And sometimes you see these weird infections called fungal ear infections. And actually, we see these often when people use ear drops or antibiotic tablets for an extended period of time, or sometimes when they actually don't need them, or they're the wrong type of antibiotics. And actually, we're seeing a lot of this recently during COVID, because it's difficult to see a GP, isn't it, nowadays with COVID? And we see a lot of patients who on the phone are being given antibiotics, either tablets or drops, without being examined, actually. And often it may not be the right treatment, and that's then causing fungal infections to develop. And when you get infections like this, the ears always need to be cleaned. The fungus needs to be removed from the ear canal, and then antifungal ear drops need to be used for at least a month to help it get better. And sometimes they need repeated cleaning even to get it better. So if you get sort of painful, muffled outer ear that isn't responding after several weeks, then clearly you definitely need an ENT opinion at that point, because it could be a fungal infection. So earwax. Everyone has earwax. Even if you think you don't have earwax, you have earwax, because we're always shedding skin. And when we shed skin in our ear canal, it mixes with oily secretions produced in the ear canal that make wax. And it can be dry, it can be wet. And the picture on the left, you can actually see past the wax and see the eardrum behind it, whereas the one on the right is a bit wetter looking, but you can see the whole ear canal is blocked there. So this scenario on the left is unlikely to cause hearing loss, but the one on the right might cause hearing loss. But actually, earwax usually doesn't cause hearing loss. When it does cause hearing loss is when people have used cotton buds in the ears, because what that tends to do is often push the wax further in, sometimes even onto the eardrum. And when that happens, then you definitely have muffled hearing, blocked ears, and hearing loss in that scenario. And I think my next picture, and this kind of explains why. So the earwax is normally made in this part of the ear canal, and then it migrates outwards. But if you put a cotton bud in, it pushes the wax onto the drum, and then that process of the ear self-cleaning doesn't work. And then you always need help when that happens. And this kind of diagram explains why, again, really. This is a cotton bud. So the ear canal, can you see the ear canal is not a straight tube, it has a kind of kink in it, a bend in it, and that's normally always has that bend. And the problem with pushing the cotton bud in, it pushes the wax against the drum, or you can actually scratch the skin of the ear canal, or just stop that kind of natural ear cleaning process that is meant to happen normally. Now, of course, in some people, you may have abnormally narrow ear canals and may be more prone to this. You may have eczema or psoriasis or some kind of other skin condition that make you more likely to get dry wax that won't come out naturally as well. And this is why you may need help with getting earwax out. Of course, using olive oil drops or earwax softening drops can soften the wax. It may retrieve the situation, but if it doesn't, then you need your ears professionally cleaned. And again, actually, olive oil is a great person to see for that, because you can do it locally in the community to get the wax out. And really, it's only if the wax is actually right up against the drum do you probably need a specialist ENT opinion to get it cleaned with ear muck suctioning. Now, swimmer's ears. This is very, very common. And we get a whole influx of people with swimmer's ears, normally around about late August, early September. There seems to be a prevalence of people going to holiday to Turkey, but there are other countries as well. It hasn't happened last year, surprise, surprise. No one's been away, of course. But when water gets trapped in the ear canal, we have normal bugs that always live in our ears naturally. The problem is if you get infection. And that's why I really stress the importance of not using cotton buds, as that will affect that process.
Mums do that all the time. I'm trying to tell them that.
And initially, you may get away with it. Initially, you may get an ear that feels a bit itchy, full, and it just be a little bit sore, and that can get better on its own if you're lucky. But it can then get worse into proper ear pain, proper discharge. The ear canal can become really swollen, even swell shut, like the picture I showed you earlier. And then you get hearing loss and so on. And actually, the pain can be quite distressing. And on the outside, you may look normal, actually, but you have intense pain inside your ear, and you can be really quite miserable. You can't sleep properly and so on. And if you're really unlucky, the infection in the skin of the ear canal can spread to the face as well and around the neck and so on. You get glands enlarged in the neck as well. So it can be quite horrible sometimes. What can you do about this yourself? Well, you should definitely use painkillers if you're in discomfort. So things like paracetamol or ibuprofen, which has an anti-inflammatory effect. But of course, if you take ibuprofen, make sure you take it after food, otherwise it can upset your stomach and you can get some gastritis. Sometimes a warm or cold flannel, and people often will alternate over the ear, can be quite soothing. And if you've got any discharge at the edge of your ear canal itself, you can of course clean that, mop that away, but don't put cotton bud in the ear, but you can mop the outside certainly. What you mustn't do actually is leave more cotton wool in the ear. That will actually encourage the infection. So a lot of people will do that thinking it will collect the discharge, but actually you want to let it drain. You don't want to use block the ear. That will make it warmer, more moist, more humid, which can make the infection worse. So actually leave the ear open is a very important thing to do. And you want to avoid getting water in the ears when you've got an infection already. So again, be very careful about that. Definitely no swimming, obviously, absolutely no swimming. Now, if it doesn't get better very simply in a day or two, then you'll need medication. So ear drops. Now, sometimes your GP can give this. What we can do as ENT doctors, we can clean the ear canal, and most GPs aren't able to do that, unfortunately. And it's all about ear microsuction. Use a little hoover to suck the discharge and debris out. We want to avoid introducing water in the ear, so we don't want to syringe the ear, we want to suck it all out. So we're avoiding pushing things up against the drum. And if the ear canal is very swollen, like I showed before, then we may need to put a wick in the ear, a dressing, to allow the drops to penetrate into the ear canal. Otherwise, the drops can't get in. What can you do to prevent getting infections like this? Well, I mentioned about keeping the ears dry. And if you do swim a lot, which is important, I'm not discouraging anyone from swimming, you've got to keep fit and keep healthy. But it's good to try and dry your ears after swimming. Again, this is not with cotton buds, but if you just shake your ears to one side to get the water out, you can even use a hairdryer about sort of a foot away from your ear to try and dry any moisture inside. You can obviously mop the outside. You can wear earplugs when you swim, and there are various types of earplugs you can get. I recommend soft moldable earplugs that are squished into the outer part of the ear, because they'll fit you perfectly, squish them in. And you can get swimming caps, you can get headbands that go around your ears when you swim as well. There's a very good company called Ear Bandit, Ear, B-A-N-D, Band It. They make a nice headband that goes around your ears when you swim, and that's pretty good at stopping water penetrating into the ear. But avoid cotton buds, hair clips, paper clips, fingernails, anything else that might scratch the ear canal. And then keep your ears wax free. Now, the reason why this is so important is that we all make wax. And the problem is if you've got a lump of wax in your ear canal and you get water in the ear after swimming and it gets trapped behind the wax, that's when you're going to get a problem. Because if you keep your ears wax free, that's less likely to be an issue for you. Now, moving on to something different now, and I'll take questions at the end, obviously. But this is a picture showing an eardrum, like I showed earlier. But in this scenario, what you can see, I've lost my cursor, oops, is bubbles, and this is liquid. So above here is air, and down here is liquid, and this is glue ear, or fluid behind the eardrum. The official medical term is a middle ear effusion, which means fluid behind the eardrum in the middle ear. So glue is really common in children, but it happens in adults as well. We see it in adults all the time, actually. And the reason why is that the tube that joins the back of the middle ear to the nose, the eustachian tube, if it's not working properly, which is very common if you get a cold, snuffly nose, blocked nose, a lot of catarrh, or if you've flown on a plane and got off a plane after you've had a cold, that tube often doesn't work properly, and you get fluid collecting behind the eardrum. And here's a nice picture here showing the sort of fluid level. We don't normally see arrows when we look at people's ears. That would make it very easy if we did. But this shows the fluid level, a line of fluid, and this shows bubbles. Now, actually, when we see bubbles in the ear, what that shows is actually the ear's trying to get better. Because actually, when you get fluid in the eardrum after a bad cold, often it will get better on its own. And often there's nothing we need to do except try and equalize your ears by blowing your nose, swallowing, to try and help the eustachian tube work better. But if it doesn't get better enough, then we can fix that surgically with something called an ear grommet. And it's a little tube that we pop in the eardrum here, and then we suck the fluid out. And the grommet stays in the ear on average about a year or so, and it falls out on its own over time as the skin on the eardrum moves and grows. The only downside of a grommet is that while it's in place, you need to be careful to avoid getting any water in the ears, because if water goes through the grommet, it might cause an infection. So to be on the safe side, we recommend avoiding that. One good thing about a grommet, and we always get asked this question about, is it safe to fly with the grommets? It's brilliant to fly with grommets, because when you put a grommet in place, you've got no pressure difference across the ears. So actually, you'll have no pain at all in your ears. You're better off with a grommet flying than without a grommet, actually. So have as many holidays as you can when you've got a grommet in place, because you won't get any ear pain when you fly. Now I've done it. That's really quite a quick run through. That was just a picture of what a grommet looks like when we look in the ear. They're often white, green, or blue. There's no difference. It's just there's random colours really. But this shows a grommet sitting in the eardrum, and that's the opening of the grommet, and that's where we suck the fluid out to help clear the glue ear. Now that was a very, very quick run through of some basic principles about keeping the ears healthy relating to preventing ear infections, earwax, and why we sometimes put grommets in the ears for glue ear. But I really want to leave a lot of time for as many questions as possible. I'm hoping you've all got a question each or more. So I'm happy to open up to questions.
Sam, that was fantastic. Thank you very much for the time and effort that you put into that. And I'm sure that everyone has got some questions. Could you perhaps just stop screen sharing, and then I can bring up a list of participants maybe.
Yep.
That's wonderful. So yeah, if anyone's got any questions, if you go to the reactions box at the bottom of the screen, and you will see the raise hand feature, and if you want to pop your hand up, then I'll see you in the participants box, and I can unmute you. Perhaps while everyone gets their courage to ask a question, Mel's iPhone, right, let me unmute you. Mel,
good evening, thank you for that.
Hello.
A friend can you hear me?
Yes, yeah.
Oh, good. A friend recommended that you can buy ear candles where you light them and they suck out the wax. I'm a bit skeptical, but they really recommended them.
It's important to be skeptical. You can do a bit of harm with those. Obviously, first of all, putting anything in the ear can push any wax that's already there further in. And this is the problem. If you know what your ear canals are like and how much wax you've got in them, if it's just a little bit of wax, you want a bit of warmth to soften it up, then it might work. The problem is, if you've got a column of wax already in the ear canal, you're more likely to push it further in. That's the problem. And actually, there are a lot of home remedies for clearing wax. You see various devices, even home DIY syringing devices and screw devices like a corkscrew that will, allegedly trap the wax and pull it out. The problem with all these things is that if you've got a big column of wax, it'll actually push it all in. So you may get away with it if you've got a very little bit of wax, but there's a lot of risk as well. That's the issue with these kind of DIY devices.
So you said something about using a hairdryer and to dry your ear. So would a hairdryer warm the wax possibly and soften it?
So that's a good question. The reason the hairdryer is really to dry any moisture in the ear canal, really. And you don't want it too hot, of course, because that'll be uncomfortable. So it's really just a slightly moist, a slightly warm, dry air to dry the ear. Actually, with earwax, you don't want to dry it; you want to moisten it really to get it out. So actually, no one's ever asked me whether the hairdryer would help, but I think it's a dry heat rather than a moist heat. So I suspect not. I'd really recommend it for drying the ear to help with moisture rather than for earwax.
Okay, thank you very much.
thanks for your question, Mel.
Good
It was really
question.
good. Wendy, let's have Wendy.
Wendy, I think you're on mute still.
Hi there, thanks very
Hi
much
there.
for that talk. That was very interesting. I've got two questions.
Yep.
One is, can it be hereditary to have more wax than, say, normal and keep having it syringed? Because certainly my father had the issue and my brother did. So can it be a hereditary trait?
So we always get asked that. And the answer is, it's just really common anyway. I think that's the honest answer. Now, certainly, if you have narrow ear canals, that can run in families, certainly.
Yeah.
And things like eczema, for example, will run in families.
Yes.
There's something called atopy where you get asthma, eczema, and dermatitis together.
Yeah.
And if you have eczema, you're more likely to get earwax issues. So that can run in families. But otherwise, it is just common anyway, really. So.
All those things you've mentioned are all running through. The next question is, I used to have my ears syringed maybe every 2 to 3 years. Now I'm finding it's at least once a year. Is that common as you get older? They need to be done more?
Yes, so this kind of skin shedding process and the way the skin migrates in the ear canal may well change as we get older. So we do see it more commonly as one gets older. That's definitely true.
Okay, yeah. Those were my questions. Thank you very much.
Yeah, good questions.
Thank you.
Thanks, Wendy. Let's have Debbie.
Debbie, I think you're on mute still.
Okay,
There
here I
we
am.
go.
Can
Welcome.
you hear me? Yeah.
Yes,
Well,
yeah.
I was going to ask a similar question to Wendy, actually. As time has gone on, I'm finding that I need my ears cleaning out more often. I wondered if diet plays anything in this. I've heard that eating dairy can sometimes sort of cause more sort of blockages. I just wondered if diet does come into it at all.
So certainly, again, going back to eczema triggers can be an issue, certainly, or any skin condition triggers. In terms of dairy, I don't know specifically that. Dairy does have an effect in ENT in general. It makes mucus thicker in the nose and throat area, for example. Yeah. So we often recommend dairy exclusion trials for those kind of problems, but not
right.
problems, in all honesty.
Yeah. Okay, and I was going to sort of say that the more that you have your ears cleaned, do your ears get more used to being cleaned regularly, and they sort of kind of want to be cleaned more regular? Or is it just
it's a good question, but there's no evidence for that really. The skin in the ear canal should naturally migrate outwards. It's only if the wax is further, deeper inside. But what may happen, some people think, is you may get more sensitive to the awareness of wax or the feeling of it. And that may be a reason why you may want it done more frequently.
I find that I need to sort of every 3 or 4 months, it becomes uncomfortable. So I do get them cleaned quite regularly. Yeah. And
everyone's feeling is different. It's almost a subjective sensation. I see people who have very little wax, but it really drives them mad, and you clean it, they feel so much better. And we get other people who come for other reasons and are complete blocks and don't even seem to realize it's everyone's different in how they feel things.
Yeah. Well, I've certainly been a hell of a lot better since I've been having them cleaned out. No more infections, no more swollen neck and everything. That's just wonderful. Thank you.
Great questions, Debbie. Thank you. Thanks very much. Let's go to Roger. I think you're next on the list.
Thanks. Good to see you both again. Yeah, I've got very narrow ear canals and only one working ear, so I really need to look after the one ear that does work. No problems with it. But should I be doing anything to regularly assist cleaning, or just leave it alone and wait for it to go wrong?
So you can use earwax softening drops like olive oil ear drops that you buy over the counter in the chemist every now and then. But the danger, especially if you've got narrow ear canals, is you may clog the ear with the oil. So I'd use it very sparingly is the answer. Just a drop, at most each time you do it. And if you find that when you do it, you clog up straight away, then don't do it, basically, because it'll make it worse.
Okay, well, that's certainly what happened. So I try not to. And if I was going to use anything, then is it bicarbonate soda or something like that?
Yes. So actually, there's various things you can buy over the counter. Sodium bicarbonate drops. There's all the branded Otex type things, olive oil ear drops. In all honesty, most studies in the ENT literature show no real difference in any of them. So you can use whatever you fancy, really, if it works for you. And if it makes it worse, then don't use it, obviously.
Not going to use it until I need it. Thanks a lot, Sam. Cheers.
Good question, Roger. I'm going to see if I can. I'll figure out how I can do this. Kevin, could you go next for us, please?
Okay, thank you very much, Sam. You haven't mentioned anything about the loudness of sounds you listen to. I certainly find as my hearing gets worse that I like to listen particularly to music louder to get the enjoyment. And yet clearly in my history, that's probably one of the causes of my deafness. So my question really is, how do I know to regulate that within reason? So
any sound that is uncomfortable is bad for your ears. So that's the simplest way to look at it, really. And as you know, it's mandatory now in various occupations, a lot of occupations where there's loud noise exposure, that you have to have ear protection. And certainly we still see patients with noise damage hearing loss. So when we have hearing loss patterns, there are different patterns to hearing loss. Some are obviously age-related, some are you're born with, some can be related to infections, and some have a typical pattern of noise damage. And we still see that in anyone over the age of 60 upwards, we still see noise damage, whether it's occupational work or music. But actually in 40-year-olds, we never see that anymore. And the reason why we never see it anymore, because they all wear protection. So all musicians wear protection now. Anyone at work in factories wears protection now. But any noise that hurts your ear is definitely bad for it. Now, those of you who get the tube to work or socially will notice that sometimes the central line is excruciatingly painful, the sound it makes. But luckily, it's only for a second or a few seconds, thankfully. But any prolonged painful noise will damage your ears. And that's why it's really important to be careful about that and to wear protection. That protection can be something simple as an earplug, or you can get professional ear defenders, professional sort of headphone type things that silence or protect the ears. But yeah, it's very important to do that. It always amuses me when you see instructions that come with headphones, with AirPods and things that say things like, we recommend you do not use it above sound level 5, 6 or 7. You know, think, well, why make it go that loud then? They know it's going to damage your ears, and yet they make them go that loud.
Okay, thank you. That's helpful. I guess the corollary of that is that if I don't feel uncomfortable, then I'm probably okay, which is, I think, probably what I'm looking for.
Yeah, we also often say that if someone's sitting next to you on a train and you can hear their music really easily come out of their headphones, it's probably damaging their ears. It means it's too loud. So if you've got grandkids or anyone else you notice that, you better tell them off. Don't blame me though.
Thanks, Kevin. That's much appreciated. Next on the list is Clive Walker, please.
Hello, Clive.
No, maybe Clive's hand's up by mistake. Okay, let's move on to John Kitson, please.
Hello.
I think you're still muted, John. Try and unmute yourself.
Can you hear me?
Yes. Hi, John.
Right, hi. Can you tell me, is there any link between hearing loss, hearing aids, and dizziness or vertigo?
Not a link from the hip. Well, anything that blocks the ear can make you feel a bit dizzy, potentially. So that can be a link. And obviously, the inner ear deals with hearing and balance. And as we get older, of course, we're more likely to need hearing aids and more likely to have balance issues, because balance and vertigo is dependent on a number of factors, including how well our joints work. So as we get a bit older, we get a bit of stiffness in our neck, shoulders, or any joint issues at all. It makes vertigo and dizziness more likely. But the hearing aids themselves wouldn't really make you feel dizzy unless they're really blocking the ear.
Right, okay.
And that's why hearing aids are designed, well, I mean, you asked the wrong person about hearing aids, obviously, but that's the reason why hearing aids are designed to fit in a certain way, to allow air in a certain way, to not fully block the ear canals.
So if I'm trying to find the cause of dizziness, I should be looking at things other than hearing aids. I should
Absolutely.
be looking at...
Yeah, there's lots of things that can affect dizziness. So you need to check your vision is okay, your eyesight's okay, any problems with the joints, the neck, spine, or any other joints as well. Obviously, general ear health. And then there are other issues as well, where you have any headaches and other reasons why you can get dizziness and vertigo as well. So it's quite a complex thing, actually, vertigo. Lots of different things can cause it or contribute towards it.
So is that something I should talk to my GP about, or someone like yourself, an ENT consultant?
So, well, obviously, in the first instance, definitely see a GP, but they'll probably refer you to me anyway.
Right. Okay. Thank you. That's very helpful. Thank you.
Thank you.
Good question, John. Thank you for that. Let's move on to Peter, who's been waiting very patiently. Over to you, Peter.
Hello.
Hello.
Thank you for the information this evening. It's been very, very useful.
Good.
I have a particular problem which is not just earwax. The problem is always with the right ear anyway. But I do suffer from earwax, but I also suffer from sweating, which I sweat a lot from my head, unfortunately, which whether it's following the tubes into my ear or it's the ear sweating, but I get a lot of additional problems from that. It's always the right ear. Is there something I'm doing wrong, or is that something I've got to live with?
And it's always only the right side.
99% of the time, it's a right-hand side problem.
Have you ever had any surgery on the neck at all, in particular any parotid surgery?
No, but I did perforate my eardrum, my right eardrum, many, many years ago, 20 or 30 years ago.
Yeah. So I can't see how that would cause the sweating issue. The reason why I ask about the parotid gland, which you haven't had done, but sometimes if you have surgery on the parotid gland, it can make some of the nerves from the parotid gland grow back to the skin around the ear and make you sweat when you eat, strangely. But that doesn't apply to you, obviously. So I can't think of any specific reason why you would get that just on one side, I'll be honest with you. Any earache or leaking from the ear, but just sweating?
Not in the recent past. I have always suffered from earache, ear problems from childhood. But now it is, there's no real earache as such. It's just I go from being normal, so to speak, to having a lot of wax and a lot of sweat in the ear. But it's, as I say, it's the right ear.
Yeah, that's a difficult one to explain without examining you, to check that the drum is normal in case there is something called a retraction where the drum's sucked in, or even a hole. So if that concerns you, it's worth asking a GP for referrals. We can have a look.
It does concern me because obviously during the summer months when your head's getting hotter, I'm sweating more. It is a constant worry. Can I go out in the sun because I'm going to cause myself a potential problem?
Yeah. So sweat is generally controlled by a part of the nervous system called the autonomic nervous system. And if we see in the clinic, we can check for things like that may be associated with that.
Okay, thank you.
Thanks for your question, Peter. It's much appreciated. Thanks for being patient as well. We've got a question from Akpo on the chat box, which says, there clearly is no safe way to use cotton buds if they should be used at all. Given how dangerous they are, is there a plan by audiologists to get the government to ban them?
That's a very good question. So on the packet that cotton buds come in, it always says, do not use in your ears. And yet everyone uses it in their ears. It's obviously they were initially invented for that purpose. And now that we advise you don't do that, and that's why they come with that warning on the packet itself. My daughter tells me she uses it to help with adjusting her makeup and things like that. That's beyond my expertise. But it's a good question. Yeah, should we have a petition to get them banned?
I think Akpo's being a bit militant there. It's all right, I know Akpo, I can say that. Wendy, let's have you again.
I've unmuted myself.
Yeah.
I think Bishop Stortford is really lucky to have DigiClear. So thank you, Oliver. My question is, why did the NHS stop doing syringing like they used to?
That's a very good question, actually. So most of the time, syringing is really quite safe to do, in all honesty. If you know that someone's got a normal size ear canal and a normal eardrum, then really it should be a safe thing to do. Unfortunately, it's difficult to get too political or pick on a certain group of health professionals, but I think, and this is quite controversial, I might be saying, but the way GPs are funded and the way they tend to work they tend to work depends to be on how they get remunerated. So you'll all notice that you're all called for your flu jabs and for your COVID boosters and etc. And it's important that you do have those, obviously. But the GPs get paid for doing those. And that's why they go to great efforts to call you to come and have them done. But they don't actually get paid, or didn't actually get paid, for doing ear syringing as a separate service. And unfortunately, I suspect that may be a reason why a lot of them stop doing it. Also, of course, in some people, if you do syringe ears, which do have narrow ear canals and it doesn't quite clear, you can actually cause harm, cause an infection, push the wax further in and make it worse. And I think for a lot of nurse practitioners, if they get a few experiences like that, that puts them off doing it, unfortunately. But it's a shame, because actually 9 times out of 10, it is safe to do in the community, really.
Yeah, I did wonder if it was a medical reason, but I can see your point of view with the costings as well. Thank you.
That's a really good question, Wendy. I think everyone's been wanting to ask that one. So well done for being brave.
Well, there's not many places like yourself that do it. I don't know anyone else in Stortford. And I think there's one place I've heard of in Harlow. So, you know, where do people go now?
Yeah.
Well, actually, I should say it's a very good question, because because people become a bit desperate with this kind of issue, there have been various sort of earwax clearing clinics setting up all over the place, really, and some of them are a little bit dubious, I'll be honest with you. So someone like Oliver is obviously an audiologist with many years experience and knows what he's doing, has the right equipment. But there are some clinics which are setting up in railway stations and all over the place, actually, offering a kind of earwax service. And I see a lot of patients who've been to these various clinics, one in Liverpool Street, one in Brentwood, where they've not cleared the wax. The patients have paid their money and they still feel blocked or felt worse afterwards. And they've come to see me, and it's, you know, I'm not pretending I'm a genius. I've just cleared the ears and they feel better, which I expect Oliver would do if he'd seen them as well. So actually, people do become desperate because these services aren't offered. And that's a shame, actually, isn't it, really? Because it's important to know where to go and who to see. So you are obviously lucky, Mr. Stortford, that you've got Oliver.
Yeah.
Thanks, Wendy.
What about these? I think you can buy self kits to do it. Not that I want to, but
no. So the danger of those is they may work, but they may also make you worse. That's the danger. So in general, with the self-cleaning kits, if you've got just a little bit of wax, they probably will work quite well. But if you've got a column of wax, they may actually push it in and make it worse. And the problem is you don't know how much wax you've got, do you? That's the problem.
no.
Thanks very much for your comments, Wendy. I'm going to move things along so that we don't wear Sam out completely, because he's been joining.
Overwhelming with lots of questions. That's why I kept my talk short.
So we've got 3 people with their hands up, and we're gonna have an amnesty, and we're gonna cut it after that. So Cheryl and Ken, let's have you.
Yeah, it's just me actually, Cheryl.
Hi, Cheryl.
The question I've got is I do have very narrow ear canals. I've in one ear, on my left ear, I have very dry skin, and it's really irritating. It's been itching, and over the years they just say use olive oil, which doesn't really do anything, and the build up of skin, it's difficult then to actually clean my ear. So that's another question, how do I clean it? But is there something I could be using to get rid of it?
So in your scenario, there are drops we use, they're called betanazole drops. They're like steroid drops.
Right.
Now, in the same way that someone has eczema on the arm or leg or anywhere else in the body, you'd use steroid cream. You can't use steroid cream in the ear canal because it will clog the ear, obviously.
Right.
But you can use a droplet version. And what it will do is it'll decrease inflammation in the skin to stop it getting dry and itchy. And that will work better than the olive oil if the olive oil isn't helping enough.
Right.
So your GP may be able to prescribe that for you. It's not an unusual.
Sorry.
So they're called betanazole, B-E-T,
yes,
N-E-S-O-L.
Sorry,
betanazole, B-E-T-N-E-S-O-L, betanazole drops. And they're basically steroid ear drops is really what they are.
Yes.
And like I said, it's like a treatment for eczema, because if you've got dry skin, it's like a bit of eczema in the ear canal, really.
Okay.
But again, if you've got narrow ear canals, just use a drop at a time, and only to use when you feel itchy. You don't need to use them regularly, but just when it feels itchy for that one day, it's worth doing a drop at a time.
Right. Okay. Because I get the dry skin building up with the wax, and I'm having to have my ears cleared more often now.
Yeah.
So is there any way I can clean the dry skin away?
Well, hopefully by using the bentonol drops, it'll stop it getting too dry and help the skin move naturally and move as it should do.
Okay. Lovely.
In the same way that the olive oil is trying to sort of almost act like a moisturizer in some ways, the bentonol is actually has a pharmaceutical ingredient to reduce inflammation rather than just moisturizing it.
Lovely. Thank you very much indeed. I'll do that.
No problem. Hope it helps.
Thank you.
Thanks, Cheryl. Thanks for asking. Let's move over to Clive.
Hello, hopefully you can hear me this time.
We can, yes.
Jolly good. Technology. I've had some hearing aids prescribed from Oliver's clinic in Brentwood by Roger, who has now retired. I'm using the open ear ends. I've forgotten what they're called, the little parts that go into the ear. But I have those on my hearing aids, and I've already had to have my ears syringed, specifically one ear compared to the other, because I was having difficulties in that ear. And the thought has come to me that if you put something in your ear on the end of your hearing aid, that's going to push the wax in. Is that much of a concern? Or
so if your ears are clear of wax to start off with and you leave the hearing aids out when you don't need to use them, then they should be able to self-clean. The problem is if you've got a load of wax already in the ear canal when you put the hearing aids in. So when the hearing aids are fitted, obviously they'll check the ears are clear at that time. Obviously you will then go on to make wax, but as long as you leave the hearing aids out as much as you can when you don't need them, hopefully the ears will self-clean. But it can be an issue, yes.
Yes. That also brings me on to a question about my mother-in-law has NHS hearing aids that are much more powerful than mine. And she wears those from morning till night. And they're the ones that are molded into fitting into the outer ear. And I'm just asking, how on earth can the ear clear the wax from her ears if they are plugged up all that time?
So hopefully leave them out at night time is enough for her, perhaps, and that's good if that's the case, and that may well, I presume that's what's happening, but if she gets problems, then what she may want to do is alternate from one ear to the other to leave them out for longer. Right. But if she's been fine, that's great. If she's been fine, she's been fine. That's good.
Yes. Okay. Thank you very much for your very interesting talk and for the questions. Yeah.
Thank you for the question.
Thanks very much, Clive. Thanks for that. And finally, because you've been very patient, Paul Chandler, please.
Hi, thank you. Two questions. I get a lot of earwax in my ears. I've tried the wax, the ear roll. How often, if you seem to generate quite a lot of wax, should you put? I was thinking of the sodium bicarbonate. How often would you recommend putting it in your ears? Once a week, once a month, or is it an impossible question to answer?
It is impossible because everyone's different. And you can probably only work it out over time, really, I guess. But what you don't want to do is clog the ear with the drops or the oil. That's the key thing, really, because that'll make it worse. And the reason why it's an impossible question to answer is because it's related to how much wax have you got to start off with in the ear, and how narrow your ear canals, and so on. So it's really a case of almost playing it by ear. Sorry about the poor joke, but everyone is different. If you've got just a little bit of wax, then I would just say, once every couple of weeks, once a month enough. If you want to have intensively try and soften the wax, then you might want to do it daily for a week or two. So everyone's a bit different, unfortunately.
Okay, and the second question, I worked for myself for over 20 years wearing Peltor ear defenders, the correct ones, which had a radio in them that was maxed out at 85 dBs, which I didn't ever have that high. I've got tinnitus now. Has any research ever been done to find out whether wearing ear defenders for long periods of time with radios in them for like 4 or 5 hours a day will actually damage your ears, or is it, as long as it's not over 85 dB, safe to have a radio?
It's about the sound volume, really. And also remember, actually tinnitus does become more obvious as we get a bit older, for various reasons, natural age-related loss, but also it's made worse by stress. And of course, last 18 months have been very different for all of us, obviously, by poor sleep, These are the commonest factors that tend to make tinnitus awareness more problematic. Even dental problems with the jaw joint, we call it the TMJ, can make tinnitus worse. So there's various things that can make it worse. In terms of stress, we see a lot of people recently who've, had worsening tinnitus. And I say to them, oh, it's, stress makes it worse. And they all say they're not stressed. And I all say to them, what have you done for holiday this year? Then they rant to me about the fact they haven't had their holidays this year they normally have. And I try to explain that they are stressed. Even if you don't think they are, because we're not living normal lives still, are we? No. We're not able to go out as normal and do things as normal still. So even if you don't think we are, unfortunately, we all have an increased level of background stress, regrettably, because of what's going on in the world still.
Right. But there's no evidence, there's no research being done about ear defenders and radios in them over long periods of time.
It's specifically it's not about the radio waves, it's about sound volume and how long you're exposed to loud sound volume is the issue.
Right. Okay. So probably not then. Right. Thank you.
Thank you very much for that, Paul. And I think thank you to Sam. I think you've given us nearly an hour of your time this evening, Sam, and I know you're really busy and it's very much appreciated. I think your talk was really interesting and I really appreciate the effort that you put in for that.
I was impressed with the quality of the questions, to be honest.
Yeah, I was. There was a lot of very, very good questions there. So I think everyone's very passionate about their ears and about their hearing. And obviously, it's something that's valuable to all of us for communication. So it's nice that we've got someone that we can put those questions to. So very much appreciated, Sam. And thank you, everybody, for joining tonight as well. As I say, we'll try and do this again in sort of 3 months' time. If you have any questions that you want to ask myself or the team, you've got all of our contact information on the email. So please don't hesitate to get in touch. If there's anything in particular that you feel you'd like us to cover on a Zoom meeting that is obviously ear or hearing related, preferably, then please do contact us and let us know, and we'll make sure we get you that sort of content. So thank you all very much for coming this evening, and we look forward to seeing you again soon. Thanks very much. Bye-bye.